Alright, here's our venipuncture video. Got my order, insert IV saline lock. Going over to wash my hands and gather my supplies. Hey Mr. Hurt, it's me Brandy, I'm back. So I just saw the doctor left and he wrote an order for us to start an IV. Did he discuss that with you? He did, okay. Did he explain to you why we're going to put in this IV or saline lock? Right, those pain pills aren't really working to provide any relief. You're still rating your pain pretty high. So we're going to switch you over to some IV medications for pain relief, and hopefully we can get you down to a lower number rating your pain and more comfortable so that you can rest. Can you tell me your name and date of birth? I'm a Hurt, 1234 88109530. Okay, any allergies? No. Specifically to betadine, shellfish? No. Adhesive intolerance? No. Okay, great. Which hand do you write with? Your right? Okay, then I'm going to use your left arm. Is there any reason I shouldn't be able to use your left arm? No. Okay. Any mastectomies? No. I didn't see renal failure in your history, graft, shunt, anything like that. All right. Have you had any procedure on your skeletal system or your circulatory system that would make you different than anyone else in the hospital as far as the way your anatomy's laid out? No? Okay, good. Well, let's go ahead and get this started so that we can get you some pain medication as soon as you need it. We're going to use that arm. Is that all right with you? Yeah. Okay, perfect. I'm using smaller gloves. Ooh, they're nice and snug, but we want something that fits. May have some blood leakage, so I'm going to put down this barrier cloth. Open my supplies. I'm going to borrow your tray table here if you don't mind. Open my saline flush. Got 2 IV catheters just in case, but I'm going to get this with the first one. Open that up. Loosen it if I need to. Make sure it looks good. There. Extension set. Open it without touching anything. IV start kit. Open my tegaderm, make sure we're good there. Gauze if I need it. So first thing I'm going to check for a vein, so I'll put on my tourniquet and look up here, okay? Then I would release my tourniquet while I prime my IV tubing. And I know I'm going to go down here in the brachial vein in the lower half of the forearm. So my flush, without touching, contaminating anything, get that air bubble out. Prime my extension set. Okay, it's primed. Something I do a little different than some other people is I actually remove the cap off this extension set, and I'm going to set that in my alcohol prep so that as soon as I pick it up, it falls off and I don't have to try to unscrew that cap. Let's get it done. All right, extra alcohol. Got my betadine or my chlorhexidine. All right, here we go. Let's put that tourniquet back on. Can you clench your fist for me? Perfect. All right. Those veins are filling up with lots of blood. So I'm going to clean with alcohol. 30 seconds. 29:30. Okay, let it dry. I can do my chlorhexidine or betadine. These, you just squeeze them and let the liquid come down into the sponge and scrub. But don't use these on the mannequins, please. Now we're ready. All right, Mr. Hurt, this is going to fill, you're going to fill a stick, but please just try to be as still as possible and we'll get it done, okay? So I'm going to use my left hand thumb to retract. My right hand is going to do the stick. All right, already got some blood return there. I'm going to advance my catheter a little further. And thread, 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 all the way so that the hub is touching the skin. Retract my needle, undo my tegaderm. I'm going to grab my extension set, remove that. Now hold on. Flush. Easy peasy. Get my tegaderm. Okay, so make sure you're holding onto the hub and not your insertion site here. Place my tegaderm. Tape. Clean up with alcohol or gauze if you need to. There's really not too big of a mess here. Check my flush again. And then I'm going to lock it. Remember, it's a saline lock, so flush with saline and lock. Tape this down. Not over the insertion site, but just off to the side. So it actually looks like a J-loop. And then my pin, just nowhere, we'll pretend. Date, time, this is 22 gauge, and B, Nobler RN. Put that in on there. All right, Mr. Hurt, I've got that IV in. This is going to stay in place for a few days until we don't need it any longer. This is going in sharps. We want to make sure we don't get it wet, so if you need to get in the shower, let's cover it. Try not to pick at the tape or the tubing. If you feel like there's any burning or swelling or it's irritated, maybe warm at the site, please give me a call so I can come in and assess that for you. But it looks really good right now. I don't think you'll have any trouble with it. So I'll be back. What is your pain level? You're at a 7? Okay. So let's go ahead. He ordered morphine and Dilaudid for you. Do you have a preference? The Dilaudid? Okay, that's what most people choose. So I'm going to go ahead and bring you your first dose of that Dilaudid. You can get it every 2 hours. Where is that pain? Your right foot, burning. You've got that pressure ulcer there on your heel, so that makes sense. So I'm going to do that. I'm going to document, clean up my mess, wash my hands, and I'll be back, okay?